Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist and I practice obesity medicine in the Triangle area of North Carolina. This is a video series entitled Obesity Medicine Perspective. The last video that I did, I talked about the concept that obesity as a disease is a disease of excess body fat, and I got kind of passionate about explaining that to you, and that the fact that the excess body fat produces disease. Fat's an organ. You have too much fat, it starts signaling all the other organs in your body, hey, let's be diseased. That's kind of the simple concept. So all of our dietary therapies, our medicinal therapies, our behavioral modification tools, all of these things are designed to reduce your body fat. Your weight goes down, your disease states get better, your risk of disease gets better. All of those things are better when you reduce your body fat. So I want to briefly talk about how you store fat. And this is a central and very key theme. There are genetic things that you cannot control. I realize that. I realize that you may have been born or acquired a genetic predisposition to being obese. That doesn't mean you can't control other factors, and diet is a key factor, and I'm going to teach you the kind of things that you can eat to address the heart of this issue. Now, the heart of the issue, a basic physiologic principle, is that insulin is a fat storage hormone. The primary hormone that causes you to store fat is insulin. All right? So if you have a high insulin level, it's signaling your body to store the food you eat as fat. Now, we're meant to have insulin in small amounts, and historically, human beings were made and evolved to have small levels of insulin. We didn't have things that we were eating for thousands of years that caused a high blood sugar level, so we didn't need much insulin. Now, in this modern era, we're eating all sorts of things that really raise that insulin level. And lo and behold, we have an epidemic of obesity as a result. So the concept I want you to get today is the high insulin level produces excess body fat. And so when we start talking about dietary therapies and medication, we're going to go directly to this issue of the high insulin level. This high insulin level, by the way, is present in everybody who's got common Western diseases like diabetes, lipid problems, hypertension, heart disease. It's there. So we really need to deal with this as part of the therapy that you're going to undergo to treat obesity. Now, I just want to highlight one more thing. I talked about last time a very good body composition analysis tool called the Inbody 770. So it is a great way. This is a precise and outstanding test that when you lower your insulin level by a dietary therapy or medication therapy, you can follow your detailed body composition changes. You'll know how your lean mass and fat mass is changing with precision, and this device can do it. We're going to be giving away free tests with this device, and if you'll stay tuned to this YouTube channel, to the Dr. Simons Weight Loss Facebook and Twitter feeds, you'll see announcements about this, and I don't want you to miss them. So please follow along, and until next time, if you give me the effort, I'll give you the instruction and tools, and together we can overcome obesity.